Joining us with more about the threat as we head into the winter months, Dr. Monica Gandhi, professor of medicine and associate chief of the Division of HIV, Infectious Diseases, and Global Medicine at UCSF. Dr. Gandhi, I haven't seen you in a while. It's great to have you on the program. Thank you.
Thank you.
Okay, so according to the CDC, Americans 65 and older make up 92% right now of all of the deaths, 65 and older, compared to 58% about a year ago, looking at the numbers last summer. To what do you attribute that?
So essentially, actually, older people are always more susceptible to many respiratory pathogens, including influenza, RSV, and COVID. And there was a study from the UK that looked at 30 million people and after getting 2 doses of the COVID vaccine, and those who are still at risk for severe COVID are our older individuals. These are the ones who need boosters. They need Paxlovid if they get COVID. They need flu shots, and that will all mitigate what you just talked about, these 3 viral pathogens at the same time. We don't have an RSV vaccine yet, but the phase 3 trial has been completed, and we will by fall for RSV for older people.
Okay, and for everybody, kids too?
Well, actually for children, no, but it's going to be there was a study in pregnant women for RSV vaccine, which means that neonates will be protected when they're born. So it's going to be those 2 kind of extremes of age, neonates, but through the mother, and older people, and we'll have that by fall for the RSV vaccine.
Yeah, for next year. Yeah, we wish we could get that on the fast track, especially since you're hearing so many parents saying their kids are in the hospital right now with RSV. I want to talk to you about the booster. How is this bivalent booster different than the shot for COVID that a lot of people already have?
So essentially it has in it the mRNA, because these are mRNA vaccines that have genetic material that code for spike proteins. It has in it mRNA from both the old strain that we had 2 years ago, ancestral strain, half of it, and half of it is what's called BA4, BA5, more recent Omicron subvariants. And what the data has shown us is that getting this kind of more modern, updated Omicron subvariant booster does increase your antibodies to the current circulating strains, even though we're kind of past BA4, BA5, we're into BQ1, BQ11, other subvariants, they keep on changing, but this will just absolutely increase your antibodies. And it's definitely most important, again, for older people. That is our group that's still at risk. So anyone who's not boosted, we have 30% of those over 65 who've had this latest booster, would absolutely go get that booster if you're 65 and older.
Yeah, so there's a lot of people who haven't gotten it yet. What does the data show, Dr. Gandhi, on how COVID is spreading now, since we've seen the guidelines have been relaxed, most people are not wearing masks anymore? How is it spreading and where is it spreading?
So this is true of all respiratory pathogens. It's inside closed spaces. It's really without ventilation, because remember, ventilation, this has really been proven over the last 2.5 years, is absolutely the best non-pharmaceutical intervention. Masks are worn in different ways. It's different masks. The mask literature is getting very mixed up right now. People just wear them differently, right? It's a hard behavioral intervention. Ventilation is a great intervention. So it's inside closed spaces. So if you're at that party, which of course we're getting together during the holidays, it's now 3 years into this and we have great vaccines. If you can, keep some ventilation going in your household. Keep that window open a little bit. Just be more aware and don't go there if you're sick, please.
So I'm guessing LA County Director of Public Health saying that if the virus cases continue to rise, they may bring back mandatory masks inside schools, restaurants, bars. You don't think that's a good idea?
I don't think that's going to fly. I really don't. We have had very good data now that mask mandates haven't been as helpful as these other non-pharmaceutical interventions. People are wearing them different ways. They're wearing different masks. At this point in the pandemic, that will be the only county doing that. And I think that will be quite unpopular.
Yeah. You and I have talked over the year or so about a lack of trust in public health, given where we're at in the pandemic and some of the confusing guidelines early on. I was doing some light reading at like 4 o'clock this morning. Steve Forbes, editor-in-chief of Forbes magazine, says it's time to get rid of the CDC as we know it after he said the agency monstrously mishandled the COVID crisis. The agency does a lot more work that we don't hear about, that we're not aware of in the public, but it's also been highly criticized for being political during the pandemic. What's the medical community think about that?
Well, I agree that the messaging from the CDC on masks and boosters, those 2 especially, have been extremely confusing. In Denmark, what happened is they said, get vaccinated and you're done. You go on to normal life. That's like that was a motivation to get vaccinated. The masking coming back, going away, coming back was very confusing from the CDC. And boosters not being nuanced, like older people needing boosters more than younger, was also confusing. To give the CDC credit, though, the director, we talked about this, I think, on August 18th, said, we get it. We know we've been confusing. We know we've just been all over the place, and we are going to try to fix this. And I actually really admired Rochelle Walensky for saying that, because that's what we need to do going forward. We need leadership. We need clear direction. And it was confusing.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.